Paramedic Anderson, inbound a 65-year-old male patient. This is a stroke alert with an onset of approximately 6:0, that's 60 minutes ago.
Greenwich Hospital is all about providing great health care to those we serve, both in Fairfield and Westchester County. What makes it special are the people who work here, the doctors who practice here, and the volunteers who give so much of their time.
We're fully staffed to take care of any illness that comes through the door, be it lacerations, bruises, fractures. I'm up to patients with heart attacks or strokes, requiring top-notch medical care and services.
10 years ago, we were seeing 19,000 patients a year. This year, we'll see 42,000. Very, very significant increase. But we've been able to handle the demand. We've been able to decrease waiting times.
Becoming a regional care center has been a great boon to the community, as well as the outlying areas that come to our emergency department. It's improved the capabilities of the hospital and the quality of the care that we deliver.
Here at Greenwich Hospital in the emergency department, we save lives. We truly make a difference in patient outcomes.
We have, with the cardiology department and the neurology department, as well as the well-trained emergency physicians, the ability to recognize, diagnose, and treat stroke and heart attack in a rapid, efficient manner.
All of a sudden, you wake up one morning and bingo, you are paralyzed. You don't know what has happened to you. No one plans on visiting the emergency room. I went to bed feeling fine, and when I woke up about 6:15 that Sunday morning, I realized this was a drama about to unfold because I was totally paralyzed on my left side of my body. I tried to lift myself out of bed, fell over head first, calling to my son, John, to come to my aid. He then dialed EMS, and in a matter of about 5 to 7 minutes, they were here in my Riverside home.
Time is brain, so every second when you're having a stroke, about 1 million cells are lost. So that's a lot, right? So the quicker you get to the hospital, the quicker you get the treatment, the less damage is done. When they call a stroke alert, that you're coming, there's a flurry of activity and there's a huge amount of resources that we amass. And so Bill came in with an acute neurological event with weakness and confusion as well. The asymmetrical weakness, the one-sided weakness, that's usually a sign of an acute stroke.
Dr. Nam informed me of a drug that they've used successfully.
This is a really good opportunity for TPA because even though there's no damage yet, but there will be if we don't intervene, because clinically he was weak. We gave him the TPA, his symptoms completely resolved. This is one of the cases you dream about.
I can tell you, under an hour, I felt my extremities on my left side of my body starting to come back. I started getting a feel in my leg, feelings in my left arm. It's almost as if I didn't have a stroke because I felt perfectly fine at that moment in time. Nothing short of a miracle that I felt that way.
You get the state-of-the-art care based on national standards.
We've been designated by 2 different agencies, the state of Connecticut and the Joint Commission.
Stroke is the #1 cause of disability in the United States over the age of 70.
I just want to get treated and just actually walk out of that hospital on my own. I mean, that's what I really, really was thinking about, because no way did I want to be an invalid.
It was just a day like any other day, and I was home in my house here in Greenwich with my husband, Dennis. About 4 p.m., I got a severe pain in my chest. I had never felt a pain like that in my chest before, and I didn't know what it was, but I knew it was probably serious. We called GEMS, who came immediately. They took me down to the Greenwich Hospital, where Dr. Howes and his staff were waiting for me.
Often the patient that's having a heart attack, we have the diagnosis and are awaiting the patient before they even get here. Then when they get here, the ER is really on tune to get patients quickly prepared for a procedure.
He was looking at me and saying, I have never seen anyone your age and with your profile that is having a heart attack. I was wheeled in and I had the angioplasty right away.
Doing an angioplasty for a patient having a heart attack is the treatment of choice, and that procedure quickly, rapidly, and effectively reestablishes blood flow through to the heart. Every minute matters in this type of extreme example, and time is muscle and translates into better outcomes for the patients.
I have had good health my whole life, and I never thought anything like this could happen to me. It was always the other person. I feel really good today. I didn't realize that Greenwich Hospital had such highly advanced emergency care.
We don't know what's going to happen on a day-to-day basis, but we feel confident and the community can feel confident that we're here 24/7 to provide excellent care.
I just gotten home from work, and my babysitter met me in the driveway and said, "Don't take the keys out, I think you're going back out." Apparently some bees had formed a pretty serious nest in the floor of the jungle gym, and when my one son jumped on it, all of the bees swarmed out and everybody got stung.
Anaphylaxis is really a severe form of an allergic reaction and can be life-threatening.
They'd had bee stings in the past. With this one, it was very close to Ben's eye, and he just blew up. His eyes swelled shut. I was initially horrified.
Most of those cases, severe allergic reactions, do require immediate medical attention.
I drove him to the ER. They very quickly gave him an EpiPen to kind of calm the overall reaction and needed to get an IV in him.
We need to have very compassionate care, a comfort level that we do have here taking care of pediatric patients as well as their family members, leading to positive outcomes.
The service and the people and the experiences far out exceeded our expectations.
We've gotten very positive feedback from patients who have been cared for here in the past that they feel very comfortable and confident with their care delivered, and that is something we want to continue to provide.
And that is what makes Greenwich Hospital stand out. It's the caring, it's the feeling that people get when they come to this institution.
I'm very thankful that we have Greenwich Hospital. It's always been there when I needed it, and I always appreciate the great care and the great people I've seen there.
It's a vital necessity in this community that we have this type of facility.
We are constantly updating our technology. There's always something that we could use. We received the GlideScope, which is a fantastic machine to aid in intubating a patient, in other words, putting a tube down their lungs to help them breathe. We received that last year from the gala.
Giving in this community has helped us to provide the very best in emergency services that a hospital could provide. And that needs to continue. There's tremendous pressure on our emergency room to be 100% accurate every time in their diagnosis. And we need the capital, we need the equipment, we need the commitment of our community to make that happen, because we never know when we will need the emergency department at Greenwich Hospital.